When you work in healthcare, you're on the front lines of an invisible battle against infection. And you know what? Your most powerful weapons aren't some fancy machine or a new medicine. They're knowledge and discipline. So today, we are breaking down the absolute essential rules for that battle: isolation precautions.
So let's start with a really powerful idea. What if every single person you care for was carrying a contagious illness that you just couldn't see? Now, I know that sounds a little intense, but it's exactly the mindset that keeps you, your coworkers, and your patients safe. The truth is, we often can't tell who's infectious just by looking at them, so we have to act as if everyone could be. This right here is the why behind every single precaution we're about to talk about.
All right, here's our game plan. We're going to start with the universal rule, the one that applies to absolutely everyone. Then we'll start adding layers, covering the three main types of precautions: first contact, then droplet, and finally airborne. And to wrap it all up, we'll pull everything together in what we're calling the precaution playbook, which will make all the differences crystal clear.
Okay, so let's dive into the absolute foundation of all infection control. This isn't some special rule for a rare situation. This is the universal, every patient, every single time rule. We call it standard precautions.
You know, infection control is really built on two core ideas. The first is standard precautions. Think of this as your default setting. It's what you do for every single patient in every situation, no exceptions. Then you have what are called transmission-based precautions. These are the extra layers of protection that you add on top of standard precautions, but only when you know or even just suspect a specific, highly contagious illness is at play.
Let's just lock in the official definition for a second. The keywords to focus on here are minimum and all patient care. This isn't the most you should do. It's the absolute baseline, the bare minimum, and it applies whether someone has a known infection or seems perfectly healthy. It's all about consistency.
So what does this actually look like day to day? Well, it all starts with that mindset we talked about. Assume everyone could be infectious. From there, hand washing becomes a critical, deliberate procedure, not just something you do casually. You absolutely need to know when to use your personal protective equipment, your PPE, like gloves, gowns, and masks. And this baseline covers the whole shebang, from safely handling needles to properly disposing of waste. This is your core defense.
All right, let's move on to our first added layer of protection. This is what we do when we know a pathogen spreads mainly by touch.
So you walk up to a patient's room, and you see this sign for contact isolation on the door. That is your cue to stop. It's a clear, visual instruction telling you that before you even think about crossing that threshold, you need to clean your hands and put on a gown and gloves. This isn't a suggestion, folks. It's a mandatory step to break the chain of transmission.
Now, understanding how these germs travel is absolutely crucial. Transmission can happen through direct touch, like a handshake, or through indirect touch. That's when you touch a contaminated object, like a bed rail or a doorknob. That object is called a fomite. Some really common examples that require these precautions are things like C. diff and a lot of skin or wound infections.
Next up is layer 2. This is for germs that can take a short flight. These are the pathogens that spread through larger respiratory droplets, or, as I like to think of it, splatter. That big red stop sign on a door, that's signaling the next level of warning. It means special droplet precautions apply. But look closely. You'll notice it often requires not just a mask and eye protection for the droplets, but also a gown and gloves. Why? Because some illnesses can be transmitted by both droplet and contact. So you got to be ready for both.
So droplet transmission happens whenever someone talks, coughs, or sneezes, sending out these large droplets. The key thing here is that these droplets are kind of heavy, so they typically only travel about 3 to 6 feet before they fall out of the air. This, by the way, is why social distancing became such a big deal. You'll use these precautions for really common illnesses like the flu, whooping cough, and of course COVID-19.
Okay, on to our third and most stringent layer of protection. This is for pathogens that don't just fly a short distance. These are the ones that can actually linger in the air for a really long time.
When you see a sign like this, it indicates the highest level of precaution. And your first step always is to report to the nurse before you even think about entering. Airborne precautions require special measures, like putting the patient in a negative pressure room, which is called an Airborne Infection Isolation Room, or an AIR. It also means you have to wear a specially fitted N95 respirator. A standard surgical mask just won't cut it. The risk here is on a whole other level.
So unlike those heavy droplets that fall pretty quickly, Airborne pathogens are these tiny, dried-out particles that can float around in the air for hours, kind of like dust. This means you could potentially get infected just by walking into a room where an infected person was hours before. This is the way highly contagious diseases like tuberculosis, measles, and chickenpox get around.
To really understand the stakes when we're talking about airborne pathogens, it really helps to focus on a classic and very serious example, tuberculosis, or TB. So TB is a bacterial infection, usually in the lungs, and it spreads through those tiny airborne particles we just talked about. And what's really disturbing is that after years of decline, cases have actually been on the rise. And this is driven by a few things: new drug-resistant strains, more people with weakened immune systems, increased global travel, and crowded living conditions. This is the context. This is exactly why airborne precautions for TB are so rigid and completely non-negotiable.
Okay, we've covered the foundation, standard precautions, and the 3 main layers we add on top. Now, let's put it all side by side in our precaution playbook to summarize it and really compare the differences.
See, this playbook makes the logic so clear. I want you to notice the direct connection between how a pathogen spreads and the PPE you need to wear. For contact, the threat is on surfaces, right? So you protect your hands and clothes with gloves and a gown. For droplets, the threat is splatter to your face, so you protect your mouth, nose, and eyes. And for airborne threats that you can breathe in, well, you need the highest level of respiratory protection, a fitted N95. The pathway of transmission always dictates the protection required.
And that really brings us to the most important takeaway of all. Look, understanding these differences isn't just about passing your exam or making a neat Venn diagram. In the real world, this knowledge is literally what stands between safety and an outbreak. It's how you protect your patients, your colleagues, yourself, and even your family back home. So the real question to ask yourself is this: as you start your career, which precaution sign on a door will make you pause and double-check your knowledge first?